The program you're about to see is a news program titled For Doctors Only. It is a pilot film, representative of the format proposed for this weekly series. As the name implies, it's designed for members of the profession and is a striking departure in medical communication. In just a few moments, you're going to see a television program called For Doctors Only, a medical news program specially designed for open circuit television. As the name implies, the content of this program has been carefully edited so as to be of interest only to doctors. This program complements the proved and accepted editorial concept of the newspaper, The Medical News, which just 3 years ago was itself an innovation in medical communication. Now we are adapting medical news to television, today's most powerful medium. Television is, first of all, a personal medium. Only a visit by a detail man can surpass the impact of the personal message that television can deliver. Second, television has immediacy. Important medical events, for example, can be reported to doctors literally while they're happening. Or, more commercially, a new product, particularly one in a competitive race, can be exposed to its audience as soon as 24 hours after FDA approval. Now, you may wonder, will this medium, open circuit television, be acceptable to the physician? Well, here are some of the things we already know. A survey of over 500 doctors shows that about 3 out of 4 are interested in watching an open circuit medical series. 3 out of 4 are in favor of sponsorship by an ethical company. The reasons cited for this, incidentally, range from a feeling that ethical sponsorship would assure better program quality to an awareness of the economic necessity of sponsorship. What little concern was voiced about the effect of such programming on lay viewers is minimized by the early morning time period preferred by most physicians. That is, the pre-8 a.m. time slot should provide much of the privacy of closed circuit television without sacrificing the convenience of open circuit television. What's more, the AMA has gone on record. Open circuit medical programs directly to physicians in their own homes deserve the serious consideration of medical educators and leaders of medical thought. Now, surveys can't answer all questions. The total impact of this series, the range of its capabilities, can't be known for sure until it's actually been presented in test areas. Fortunately, test procedures are facilitated by the predictable reception range of any given station. For Doctors Only is still in pilot stage. What you're about to see is representative of the format proposed for this weekly news series. Similarly, the 2 commercials are representative of a proposed formula. There's no pitchman, no comparison to other drugs, no explicit description of results. In short, there's nothing to attract the lay viewer. Yet there is information of importance to the physician. Within this formula, there is ample room for use of animation, film segments, demonstrations, and other techniques. And now, gentlemen, we are ready. The editors of Medical News, in cooperation with Ciba Pharmaceutical Products Incorporated, present For Doctors Only, a weekly program of medical news and special reports of significance to physicians. Now here is your colleague and commentator, Dr. Walter Hopkins. Dr. Hopkins.
Good morning. It's a pleasure to have you with us in this new venture in medical communication. I want to emphasize that our program is not designed for viewing by the general public. It is directed exclusively to the medical profession. Each Tuesday morning at this time, we will present in highlight form some of the week's most interesting medical stories. We will also interview a special guest physician. Today, for example, you will meet the distinguished neurosurgeon, Dr. Irving Cooper, the originator of the operation you are going to see yourself in a few minutes. Turning now to the news, here are some of the week's top developments. Flu shots recommended for special groups. Enzyme lack proposed as cause of hypertension. and rare blood index established. Details in a moment after this report from SIBA.
This is benzonatate, a new liquid antitussive agent discovered by SIBA Research. Now in pearl form, SIBA makes it available to you, doctor, under the name of Tessalon. Tessalon is unique in that it breaks the cough reflex chain in two places. First, Tessalon inhibits the activity of the nerve endings in the tracheal bifurcation or laryngeal mucosa that initiate cough. The result, fewer cough impulses are initiated. Tessalon also acts on the vagal nuclei in the medulla. The result, fewer cough impulses are transmitted to the motor nerves. Therefore, the overall result of Tessalon therapy is fewer episodes or paroxysms of unproductive cough. Tessalon is another therapeutic agent discovered and developed in SIBA laboratories. SIBA, where research is the tradition. Your SIBA representative is prepared to provide you with more detailed information.
Now, the news. Washington, D.C. Surgeon General Leroy E. Burney has suggested that physicians may want to consider flu shots for special risk groups. Although a recurrence of last year's epidemic is not expected, he says there will be undoubtedly some cases of the disease. Vaccination is prudent for such groups as hospital staffs, patients in institutions, and industrial groups likely to be seriously disrupted. Polyvalent vaccines are in ample supply. New York. The actual and long-sought cause of essential hypertension may be the lack of a specific enzyme. This provocative theory was advanced last week by Dr. Milton Mendlowitz of New York's Mount Sinai Hospital. His suggestion fits in closely with the widely held belief that heredity is a key factor in the etiology of hypertension. Preliminary work in his laboratory, Dr. Mendlowitz reports, indicates that the deficient enzyme is O-methyltransferase, an enzyme recently found to inhibit norepinephrine in the peripheral circulation. It is well known, of course, that norepinephrine, discharged by the sympathetic nervous system, stimulates vasoconstriction. Dr. Mendlowitz reasons that lack of the inhibiting enzyme, O-methyltransferase, permits an abnormal buildup of norepinephrine, resulting in chronic vasoconstriction and therefore hypertension. The investigator stressed the need for extensive further research before his theory can be confirmed. Cincinnati. The American Association of Blood Banks has set up a nationwide master index to help identify rare blood types. The index will be kept at the Milwaukee Blood Center, also the headquarters for 12 reference laboratories in key areas of the country. For a fee of $15, any blood bank may call upon the nearest reference lab for help in identifying a blood sample resistant to cross-matching by routine tests. When donors of unusual blood types are needed, they can be quickly located through the master index. It is now my privilege to introduce our guest physician of the week, Dr. Irving Cooper. He is director of the Department of Neurosurgery at St. Barnabas Hospital and professor of research surgery at New York University Bellevue Medical Center. In pioneering new surgical procedures for the treatment of Parkinsonism, he and his associates have made significant contributions to the correction of this classical movement disorder. Here then is Dr. Cooper. Dr. Cooper, you have been using two neurosurgical procedures.
Yes, chemopalidectomy and chemothalamectomy.
Will you tell us about them?
I'll be happy to. The technique in each of these procedures is identical. The difference is a target within the brain. In one case, it's a globus pallidus. In the other, the thalamus. In a moment, I'll show you a film presenting the main steps in the procedure. At the outset, we sought to relieve the disabling tremor and rigidity of Parkinsonism by destroying the medial portion of the globus pallidus, hence the term chemopalidectomy. Later, however, we found we could relieve tremor even more successfully by placing the lesion at a more posterior point. The thalamic lesion seems more effective against rigidity and is particularly so against tremor.
Today, then, you look upon chemothalamectomy as the preferred procedure?
Usually, yes. Of our last several hundred cases, about 80% had chemothalamectomy, but there are still cases in which destruction of both thalamus and globus pallidus is necessary to achieve a good result.
How many operations for movement disorders have you and your assistants performed, Dr. Cooper?
About 850.
And most of these were Parkinsonism cases?
Yes, about 90%. Now let me emphasize, by way of preface to the film, that the aim of these procedures is to place in either the globus pallidus or the thalamus a lesion sufficiently large to relieve contralateral tremor and rigidity without untoward effects. You observe the characteristic tremor in the hands of this patient with bilateral Parkinson's disease. We are about to operate on the left side of his brain to relieve tremor and rigidity on the contralateral side of his body. Here, landmarks are placed on the skull, indicating the site for the chemothalamectomy trephine. Now, with the patient under light pentothal anesthesia, supplemented by a local anesthesia in the scalp, we make a burr hole in the skull about the size of a dime. The basal ganglia guide apparatus is now in place. Next, a double lumen polyethylene cannula is introduced into the brain aimed at the thalamus. Its position is confirmed by X-rays in the OR with a film that can be developed in 60 seconds. The cannula has two openings, one for the injection and the other leading to a small inflatable balloon. This diagram shows the cannula in place. The balloon has now been filled with a radio-opaque material. As the balloon is filled with a contrast material, the pressure causes an almost immediate cessation of movement in the patient's right hand. The patient's response is evidence that the cannula is placed properly. His response and X-rays taken before and after the balloon is filled give us a double check. The cannula and filled balloon are left in place and the patient is returned to his room. This is the following morning. The balloon is deflated and we make a permanent lesion by injecting into the cavity 5/10 of a cc of absolute alcohol. It is mixed with a contrast material so that the lesion can be checked by X-ray. A second injection is made that afternoon and a third the following morning. The cannula can be removed 24 hours later. This is 1 day after operation. The patient's right hand is now completely free of tremor and rigidity for the first time in years. In many of these bilateral cases, surgery for the second side is performed 6 to 12 months later.
Thank you, Dr. Cooper. Just a few more questions. Can anything be done if the results are not immediately satisfactory?
Yes, we reinsert the cannula and make a second lesion 5 to 7 days later. I think one reason for our higher percentage of successful results is our insistence on a second lesion if any tremor or rigidity remain.
And what percentage of success is that?
Really good results in 90%. By that I mean relief of tremor and rigidity without creating any mental, psychological, or neurologic deficiency. We now have patients whose relief of symptoms has lasted for more than 5 years.
What about mortality?
In the last 200 cases of Parkinsonism, 1%. For the entire series, 2.4%. Before we close, I'd like to demonstrate on film a particularly interesting patient. This man, a professional magician, had been on medication for 5 years, during which his disease had progressed steadily. Now, 18 months post-operatively, the change is certainly striking. He can once more perform with ease the skillful tricks of his trade.
Very impressive, Dr. Cooper. Now, finally, how would you summarize the status of surgery for Parkinsonism today?
Parkinsonism, Dr. Hopkins, need no longer be considered a hopeless, progressive, incurable disease. In properly selected cases, one or the other versions of the operation you have just seen offers a 90% chance of relief with a surgical risk of less than 2%. Weighing our experience with 850 operations against the normally ruthless, progressive nature of the disease, I believe that in many, many cases, early chemopalliidectomy or thalamectomy is the treatment of choice.
Thank you, Dr. Cooper. Now these final medical news headlines. Solid cancer-producing virus discovered. And new multiple vaccine found highly promising. The stories behind those headlines in exactly 60 seconds.
Tachycardia, almost without regard to cause, can now be considered an indication for reserpine, most frequently prescribed as Serpacil, a development of SIBA research. Now here is the mechanism of Serpacil's bradycardic effect. Serpacil suppresses afferent sympathetic activity that arises centrally. Thus, impulses to the cardioaccelerator fibers are inhibited, and the normal braking action of the vagus is allowed to predominate. The result? Serpacil prolongs diastole, allows more time for the myocardium to recover, and enhances cardiac blood flow and efficiency. So whenever tachycardia is present, almost without regard to cause, consider the bradycardic benefits of Serpacil, another therapeutic agent from SIBA, where research is the tradition. If you have any questions about Serpacil or any other SIBA products, ask your SIBA representative. He's fully equipped to assist you with information and clinical supplies.
Now our final news stories. Bethesda, Maryland. Turning to cancer research, a significant advance is reported by two investigators at National Institutes of Health. There, Drs. Sarah Stewart and Bernice Eddy have demonstrated the existence of a virus which produces solid tumors in mice, rats, and hamsters. It can be grown in tissue culture and can produce active and passive immunity. Called the SE polyoma, it is the first solid tumor virus to be grown in tissue culture. The NIH researchers believe that the development of tissue culture techniques for tumor virus and the use of hemagglutination and complement fixation tests provide, for the first time, a workable model for studying the viral origins of human cancer in the test tube. Highly promising results with the new multiple antigen vaccine were reported this week to the American Public Health Association. In tests on 224 children under 5 years of age, the vaccine produced excellent antibody levels to diphtheria, pertussis, tetanus, and polio. The vaccine was given in 3 or 4 primary shots of half a cc with a booster shot 18 months later. According to Dr. C. Dale Barrett of the Detroit Health Department, there were no adverse reactions. Meanwhile, word comes from Canada's Connaught Laboratory that a similar 4-way vaccine will soon be widely introduced in that country. From Chicago, a final news item of particular interest to all doctors. The College of American Pathologists has just released a new illustrated brochure describing the latest techniques of exfoliative cytology for early cancer diagnosis. This booklet is intended for use by practicing physicians. You can obtain a copy by writing to the college or directly to this program, Box 100, New York, New York. That concludes this week's sessions of For Doctors Only. I hope you will join us again next week when our featured guest physician will be Dr. Irving H. Page of the Cleveland Clinic to talk about recent developments in his research on hypertension. Until then, good morning.
Thank you, Dr. Hopkins. The editors of Medical News has brought you another edition of For Doctors Only in cooperation with SIBA Pharmaceutical Products Incorporated. SIBA, where research is the tradition. For Doctors Only was edited by Blake Cabot. Technical advisor, Leo Orris, MD. Produced and directed by Charles Boland. The parts of Dr. Hopkins was portrayed by Ned Curry, Dr. Cooper by Bob Pointer.